everyone. It's great to be here for the closing session of our first day of the 2024 National Health Research Forum, and what a terrific day of programming we've had. My name is Jenny Luray. I'm the Senior Vice President for Strategy and Public Engagement at Research America, and I'm so excited to moderate today's discussion, Building Trust in Health and Science with Effective Messaging and Messengers. We'll spend some time defining and homing in on the problem, and we'll also discuss what strategies are working across different communities. Each of our panelists is leading an organization that's making vital contributions in this space. So let's welcome them now. Tracey Brown, Director of Sense About Science; Tuckson, Chair of the Coalition for Trust in Health and Science; and Amanda Yarnell, the Senior Director of the Center for Health Communication and a lecturer at the Harvard Chan School of Public Health. And you could read more about them in the chat. They all have fabulous backgrounds. So let's start with digging into the title of our session, Building Trust in Health and Science. When you think of building trust, what should we be trying to accomplish? That is, how would you each describe the ideal relationship we're seeking to create between those in science-based fields and non-scientists? Reed, I'll start with you.
I think it's, first of all, thank you for allowing me to be a part of this very important experience. The idea of building trust is something that has to be earned. It has to be earned every day with every single patient or consumer encounter around health. It means being able to have the kind of relationship between individuals, individual physicians or health professionals or health disciplines with the individual. It has to do with how organizations that provide healthcare respond to the needs of individuals and of communities. It is whether or not the information that we as experts have developed through a lifetime of learning that has been replenished constantly through our fidelity to knowledge, to science, to continuous learning, having that being applied in ways that are fair, useful, and transformative for the individual as they seek to make personally appropriate choices and decisions based on science and based on expertise.
Terrific. I mean, wow, you've certainly thought about that a lot. Amanda, I'm going to turn to you. How would you describe the ideal relationship we're seeking to create?
Yeah, thank you, Jenny, and to everyone else that's really happy to be part of this event. I agree with everything that Reed just said. And what I would add or maybe like to see in the future is scientists and non-scientists in conversation. I think we often talk so much about how scientists need to communicate better to non-scientists, and we always talk about it as a one-way street. And I think if it were, my ideal world, it would be that conversation, the back and forth, the querying of what scientists really, or what community members, people really need to make better health decisions.
I mean, you're right, Amanda. We often talk about scientists communicating to non-scientists as opposed to with non-scientists. Tracey, let's hear from you.
Well, thank you. God, that's already quite a lot of quite interesting thoughts on the table about the different relationships that we're talking about here. And I feel that the sort of things that Reed has said have covered very well, particularly the one-to-one relationships, when a doctor is talking with a patient, for example. But I think what we could sort of step back and think, how would we describe the relationship between science and society that we're looking for? And for me, that is just some recognition that people coming with the science are behaving according to conventions of truthfulness. In a sense, I mean, perhaps to put it in more common parlance, they're answering to a higher purpose than just winning the argument or gaining your favor or getting you to buy their product. And so whether the odd individual doesn't behave according to those, we're bad scientists too, there is still a recognition that science represents answering to that that purpose, and it has with it conventions and standards of behavior and expectations that are to do with truthfulness and trying to get close to what is the true picture.
You know, Jenny, can I just double down on that? I think this is a very important concept, this notion of the relationship between science and society. And I think that one of the predicates for our conversation is very much that the challenges that we are facing in science are very much the challenges that we are facing with a dysfunctional and very overwhelmed society.
That's
so
I think that's a great point, because it's not a static relationship, right? It changes over time, and it's different for different communities. So
and also, Jenny, I'm sorry to butt in, but I'll tell you the other thing though is that it's not only just how different communities, but it is that what we do and the challenges we are facing are part of an overall ecosystem of whether it affects the criminal justice system, police systems, whether it's our religion. In other words, we are caught in the midst of a major comprehensive social transformation. And so our relationship as science to society is a part of a society which is changing in very rapid ways.
There's a lot to take in there, a lot to think about. So let's talk about the communication piece of it, the messaging piece of it, and let's just throw out what we think some of the biggest challenges are that the scientific and health professional community faces when they're trying to communicate effectively with the public. And now I'll go in reverse. So Tracey, I'll start with you.
Well, I think actually having confidence in talking about research is one of the biggest challenges, precisely because of the kinds of things that you and Reid have just talked about. And I feel that scientists, particularly our early career researchers, look at that space and they look at it online in particular. And they, you know, everyone sees the horror stories of the pile-ons and the, you know, what happens to people, particularly after the COVID experience, but also during climate debates and GMOs and all those sorts of areas. And I think that starts to illuminate people's imaginations about what the conversation is like. And people forget that the majority of people in our society are just, you know, like us. They don't have any skin in the game, and they're actually fairly open-minded. And the voices that you hear and see are not, they're more shrill. So I think some confidence in that sense, and confidence also in, I think, talking about research in a context where research itself is changing. We're seeing, you know, people using preprints, we're seeing, you know, paper mills, the use of AI, and auto-generated text, and these are making researchers themselves wonder what it is to lean into good science in the public space. So I think that's one of the biggest concerns. And can I just say, there's also a very particular thing where I think there's a cultural clash. When you train as a scientist, you're trained to take to heart the opinions of your peers. That's exactly how you grow. It's your PhD, it's your postdoc. When you go online, it's the absolute opposite end of the spectrum. You know, you have to learn to have a thick skin. And it's very hard for people doing science in public, when it means science online, to move between sort of internalizing the audience of their peers to not internalizing the audience of an online troll. And so I think that's also a new challenge for our researchers.
Absolutely. Well, Amanda, I know you spend time with the science community, helping to train them on different ways of communicating, including online communication. So what are, you know, 2 or 3 of the biggest challenges that you've faced?
Yeah, I mean, I completely agree with everything that Tracey just said. These are critical problems that people, I think, make people shy away sometimes from making those investments. And so much so that, like, part of our communication training here at Chan has started to include digital safety, how to navigate those kinds of conversations and protect yourself online. So I wanted to add, like, maybe an additional one that we haven't talked about yet, and I think that's just that it's not valued, right? Like, I think a lot of how science and research is set up, communication is not part of what we value as a scientific organization or a scientific society, the group of scientists out there, and therefore, you know, sometimes you could even be potentially penalized for doing that. So, so I think that's another sort of structural thing within science itself that poses another additional sort of barrier in addition to the really real ones that Tracey laid out.
We're going to get into that a little bit more, but I couldn't agree more. And Reed, what do you think the biggest challenges are in terms of communicating effectively?
I think I'll say three things. Number one is the relative mismatch between the rapid advancement of technology and the science underneath of the work that we do every day, especially in clinical medicine. The relative imbalance of how sophisticated that is with the lack of science education by the population. People simply do not understand and don't have the predicate to understand the evolution of the scientific elements that are moving forward and that are affecting them in real life. Number two is this incredibly should have been good, but the democratization of information. And I think that the point made about the preprints is a very important one, so that we have scientists now unleashing information into the atmosphere that has not been curated by the journals, not by the strict editorial review, but it just gets out there without having any guardrails around it, leading people to a great deal of confusion. And then number three, of course, Jenny, as you well know, there's this notion, this incredible sense of tribalization, where fidelity to my tribe outweighs any idea of expert opinion or scientific finding. That if my tribe is against the idea or against the science, then the heck with the science, I'm for my tribe.
Thank you. And I want to note, we're really getting some great comments and engagement here. Someone said that during her science training, she was discouraged from talking with the public about science. And someone else commented on how hyper-specialized focus is at the expense of all else. So Tracey, I want to pivot to the work that you do at Sense About Science, which I think is somewhat unique in that you start with the premise that the public needs to understand the evidence behind government decisions and scientific consensus. I mean, I'm not saying that belief is unique, but the way you go about really bringing scientific evidence to the public is quite interesting and important. Can you talk about how you bridge that gap?
I think one of the key things is actually something that Amanda's making me think it's not at all unique to us, because it's actually about putting the public in the driving seat more. Because what you find is quite often when you're talking about communicating about scientific issues, what you're trying to do is buy people's time and patience, right? To actually entertain ideas that maybe challenge them, or even just to give you the time to work something through. And one way of doing that is by starting, we have a phrase we use, public-led, expert-fed. Right? We just try and work out what it is that people want to know, should know, need to know. And that some element of accountability is often in there. So when you have people asking, why are we being told to take, to have this vaccine? They are looking for a combination of information about the evidential basis, but they're also looking for where the accountability lies for making that decision and how that was arrived at. And so I think you do empower people by starting with their question and figuring out. It's quite hard for scientists to unpack sometimes. And I'm sure Amanda experiences, it's one of the first things you do with people is when we work with researchers, is you try and guide them towards unpacking a question. It never comes along that people say, so tell me, tell me about, how a cell reproduces. That's never a question, right? What they say is, are you saying it's safe for me to give this vaccine to my child? And, as a scientist, you want to go, right, okay, well, what do you mean by safe? Tell me about your child. And, so it's about trying to unpack the question and help people to frame it in a way that will get them a satisfactory answer, and figuring out sometimes whether they're really asking a scientific question, or whether they're actually asking, is someone accountable for this? And those kinds of questions. So we make a distinction between what we would call testable questions and pollable questions. And most decisions in public life are a mix of the two, and it's very helpful to separate them. If I say Los Angeles should host the Olympics because it's a prestigious thing to do for the city, That's an opinion, it's a value judgment, you know, it's a pollable thing. We can decide whether we agree. If I say because more children will take up sport and it will reduce childhood obesity, that's a testable question, and you would expect me to have some evidence for that. And I think that's quite helpful, getting people to unpack whether their questions are testable or pollable, which sort of perhaps speaks a bit to Reed's point about, you know, tribes and so on.
Tracey, can you give us a sense of what on a very concrete level are the mechanisms that you use to bring scientists together with non-scientists to have these exchanges?
Well, we do it at all levels. So one of the things that we've set up in the UK, which is now being emulated in other countries around the world, is Evidence Week in Parliament. And I think it's become common for people to put researchers into government and make those relationships. But what we do is we lead it with the public. So we open that event with questions from all over the UK. From people asking everything about what's the evidence for water safety, why can't we stand at football matches, why do we have to sit down, is there any evidence for the safety of the two things, questions about every part of life, and those are what open Evidence Week for us, which mean that we have the ear of the politicians because their voters are asking, and we also frame the input from researchers into that space of policy and public debate. So we do it quite practically in that way, but at quite a high level. But we also work very closely with research teams who are in areas that people find difficult. So, for example, back to all the usual things like vaccines and so on, but we work with a community where a geo observatory was going in to look deep below the soil, and it was raising lots of community concerns about fracking. And we work with that community to actually find out from them what they would want that research to find out. And we use that to then work with the researchers to set the research agenda and to sort of look at where the public's idea or the community's idea and their ideas about what this new infrastructure should do for research actually connected and where they're diverged. And that was a really productive thing, so much so actually that the community designed the website as the interface for that research project in the end. So yeah, it's I think I suppose the key to it all is involvement and helping people to shape that agenda for discussion with their questions.
Right. Helping both, I don't want to say both sides because I don't want to make it seem like they're opposing sides, but helping not the non-scientists to be shaping those questions.
It's all about good questions, isn't it?
Yes,
I mean, that's the thing. Right. At the end of the day, we don't mind if people can't have mistaken answers sometimes. We all do, right? At some point in COVID, we were all wrong, right?
Well, we often, at Research America, we would talk about how there was often kind of frustration by scientists when non-scientists express skepticism about vaccines or other interventions, and yet skepticism is an inherent part, right, of the scientific method, and it is a natural part of questioning. Well, let's talk about the case of vaccines. They're clearly one of the most, if not the most successful health interventions that we have, but also a longstanding target of mis and disinformation. Even recently, a recent article in Axios found that more than 1 in 5 Americans believe it's safer to get COVID than to get a shot. So things are not getting better in terms of vaccine acceptability. They seem to be getting worse. So I want to start this question with you, Amanda. From a communications and messaging perspective, what do you think went well during the rollout of the COVID vaccines, and what should the scientific and health communities do differently in the future?
Yeah, I mean, I think that there were a lot of good things and a lot of tough things during COVID. I think we didn't enough say, here's what we're doing, here's what we don't know, here's what we're doing to close that gap. It's sort of a traditional formula that I think most health communicators would recommend, but I think we, variably rolled that out during COVID. But I mean, I think it's interesting. the public was really interested in science. I ran a science news organization during COVID. We, like many other organizations of similar ilk, saw huge increases in public sort of demand for information, to Tracey's point. The public had questions, and I think sometimes we focus too much on what we wanted the public to know and not enough on what they were asking of us. So I think that that's something I'd love to see, and that we talk here at Chan with our health communication students about what they might take from COVID going forward.
Very, very important. Reed, do you want to comment on what we did well and what, I think we know what we did poorly, but it's always good to remind ourselves of what we could be doing better.
One of the things that we did well, borne out by the data, is that for the minority community, particularly for the African-American community, we learned that despite having an anvil of history on our back, an enormous amount of earned distrust of the system, and due to and given that the vaccines, when first available, were difficult to access by the Black community, despite all of that, what we learned was that the Black community and faith-based infrastructure, when mobilized and when supported, can make enormous differences. And in fact, as we know, for the first time in history, we closed the health disparities gap, and we did it in a year, which was extraordinary. And so I think what we've learned very much is how much more we need to build that community and faith-based infrastructure, and how, by the way, we have got to stop underfunding it, so that every time there is a problem or a crisis, we start from a standing start and have to reinvent it every single time. What we didn't do as well, the one point that I just want to really emphasize, is how we handle the concept of uncertainty. That all of us who had responsibilities with communicating, hopefully life-saving public health messages during the pandemic, and knowing that we didn't know everything we needed to know, but still needed to get the population engaged and mobilized, that we had to be more certain, or at least we felt we needed to be more certain than we may have been. And so how do we talk to the American people about making decisions in a climate of uncertainty when there is the imminent threat of death on the line? I think this is one of the challenges that we will have to really grapple with and try to face better going forward.
Reed, really good points. And I just want to give a shout out. I mean, the work that you and others did with Black Americans Against COVID was tremendous. And if people aren't familiar with it, I think the website's still up. One of the pieces I recall was the video you did with descendants of the Tuskegee experiment, really pleading with people to get vaccines. Really.
That was really a lot of fun, because as everybody knows, Tuskegee keeps coming up over and over again. And so we were able to find that the descendants of those study victims were immunized themselves, and were livid that people would use the misery and death of their ancestors to not get a vaccine, when the whole point of the Tuskegee insult was denying treatment for a disease, that they would have saved their lives. So Black Coalition Against COVID.org, bcac.org.
Tracey, what did Sense About Science, what was your experience during COVID? What are you taking from it in your work?
Well, there's a couple of things I want to share with you about it, but I did just want to comment on what Reed said there, because I don't know if we have the answer to this question, but I was talking to people from NIH in Colorado in February, and they were looking for recruiting to some of our population health databases. And I said, oh, okay, so are you talking to, is it Black Americans that you want? They said, no, it's Latin Americans, because actually since COVID, Black Americans have been much more participatory. So I don't know whether that is that trust, that confidence that you've built through those programs is actually finding its way into other things as well, and participation.
Well, let me just say, because of the point, and you still have the floor, but you made the point earlier, and it gives me a chance to applaud your point, and that is, how do you engage not only with community, but trusted people in the community? And what we found was that having physicians and health professionals of color and pastors faith-based people of color standing side by side giving the messages was a huge leap up for us.
Right. Well, that's fantastic to hear. That's really good. I think the uncertainty point is one of the biggest challenges, because it often comes at scientists as being a kind of, people want the guarantee across the gap. And as Amanda has said, that scientists often feel when they're in a public space that that's what they're there to do. We had some success with reframing that in discussions, particularly with very skeptical, I would say almost cynical groups. We had some success with framing it that when you get the uncertainty, that's when you call in the scientists. You call in the scientists to measure it. Can it be measured? Is it a knowable uncertainty? Tell us more about this uncertainty, and tell us what the plan is to get through, to get across that. And that's, in a sense, I suppose, just reposing what research actually is, which is we're not deciding whether there were dinosaurs over and over again. We're actually trying to figure out what's emerging in our world at the moment. And I think it helps to try and popularize that notion. But like Amanda, I had real frustrations during COVID because many of our institutions didn't behave in that way. They behaved in that way. This was all about public health messaging, and we stick to the message. And we didn't prepare people for a change. And yet every single researcher and scientist and medic that you spoke to knew change was coming. They knew we would find out more, that our initial working assumptions wouldn't last the distance. Everybody knew that, and yet we didn't prepare people for that change in message and knowledge. And so that seemed to me a real missed opportunity. And I think we also didn't start to share with people the terms on which things would change, or the terms on which we would advocate for certain treatments. So, for example, I didn't find a single approval agency, licensing body anywhere in the world that popularized the criteria for approving a vaccine before they actually approved a vaccine. What a sensible thing that would have been if all of us as a public felt like these were our criteria that protect our public health. Now tell me whether Pfizer's vaccine made the grade, whether Novartis' vaccine makes the grade. That's how we should do this stuff, so that we own these things as public goods, these criteria for public safety, and then our bodies look at whether or not other things meet those criteria.
Well, you're all raising numerous just terrific points. On one hand, when the science community is confronted with uncertainty, particularly those in government, but also in other sectors, it's a little bit like the emperor doesn't have clothing, right? Mm-hmm. So we clearly need to get over the shame of uncertainty, right? Because it's baked into science. And then in addition, Tracey, in terms of what you were saying, we need to obviously do a better job of explaining, some key scientific concepts. I just want to thank Rosalie, one of our viewers, I think it's Rosalie, who pointed out that COVID is ongoing. So the COVID epidemic is not over. People are still dying every week. So I didn't mean to imply that it was long behind us. All right. Wow.
Jenny, can I just want to double down on what you just said though a moment ago, and that is the processes of science. One of our biggest challenges is that the majority of the American people do not understand the processes of science. First of all, they don't know a scientist. They don't have that kind of close relationship with the scientific enterprise, but they don't understand that when you formulate a hypothesis, for example, and it turns out that you did not show that hypothesis was true, that does not mean you are incompetent or inept. And so somehow or another, we are going to have to, it's the strange world we're in now where the processes of science have been turned on its head. And we're going to have to help Americans understand, no, this is the way science works.
Mm-hmm, mm-hmm. It's a little bit like democracy. It's messy, right? I don't want to get into that, but that's what came to mind. Okay, so moving right along here, let's talk about the Coalition for Trust in Health and Science, where you and others, and Research America is very involved. You're creating a big tent to address some of these issues. Why do you think a big tent approach is important right now?
It is mainly important because the magnitude of these challenges and the consequences of failure are so great that it really does require a leverage capability across the entire health ecosystem. There is no way that physicians are going to solve this, nurses are going to solve this, hospitals are going to solve this, research organizations are going to solve it. It really requires that right now, today, in America, there are hundreds of thousands of health people touching a patient, who are doing discharge planning at a hospital, enrolling someone in a clinical trial, or a public health worker getting ready for a community meeting in Missoula, Montana. There are just so many touch points, each of which, if not done properly, can further push us down into the basement of what we're trying to achieve. And so the idea then is can this issue of mistrust, distrust, and misinformation is so great that it is a direct threat to the mission of every health-related organization, and a definite insult to every oath that any of us have taken who are professionals in healthcare. So the point being is that we felt that we needed to bring, for the first time in history, the entire health ecosystem end to end. We're lucky enough to be able to say today, with thank you, Jenny, for your efforts, and for Mary Woolley, as a part of it, that we now have the 90 largest organizations in healthcare representing every single aspect of healthcare, from regulation to clinical care delivery to research to patient engagement, you name it. Everyone that needs to be in this is in it. And hopefully we will be able to mobilize that entire ecosystem, and including reaching down to affect positively the engagement that those hundreds of thousands of health people have with the millions of people that they will touch just today.
Thank you, Reed. You mentioned mis and disinformation, and bringing together the medical, public health, and research communities to combat it. Amanda, what do you think the most common mistakes well-meaning people are making right now in terms of combating mis and disinformation?
Yeah, I mean, I think one of the biggest mistakes that I see are people assuming that our institutions are the voices that are best positioned to counter misinformation. I think we now live in a world where trust in institutions is on the decline, and people are instead putting a lot of their trust in individuals. And that reality is what motivated the Center for Health Communications Health Creator Program. We're thinking of expanding that tent that Reed's talking about to include creators who make content on platforms like TikTok and YouTube and Instagram, who are deeply engaging people that public health and mainstream media often struggle to reach. I'm thinking young people, Black people, Hispanic people, people from other marginalized backgrounds. We know young people in particular are increasingly seeing social media and the creators that work on those platforms as trusted sources of health information. So we set out to create the kinds of supports that would equip and inspire creators like those to counter health misinformation, and importantly, spread evidence-based health information. We piloted our ideas last year as a randomized clinic controlled trial in a field experiment on TikTok, because we were hoping that we could extract some insights that would help organizations like ours who want to partner with the creator community to improve the quality of health information available on social media. I see a lot of parallels here with the kinds of things that Reed mentioned during COVID, these partnerships with trusted community, physical community leaders, folks like pastors and so forth, and translating that into digital spaces. We have found that organizations can work with creators to boost the amount of evidence-based health information that's available on those platforms via at least two specific kinds of investment. The first is to create these kinds of evidence toolkits to create and distribute them that are tailor-made for creators' content needs to as many creators as possible. And we found that those toolkits inspired mental health creators on TikTok to share more evidence-based mental health information, and even just to make more mental health information overall. So those toolkits are helping those creators flood the zone, if you will, with high quality content. And the second kind of investment that we've been looking at and seeing some positive response to is bringing together scientists and creators who have engaged with those kinds of toolkits in person. So we think that that's really the key for this like sort of lasting change. Our ongoing research suggests that bringing them together in person, it influences creators' health communication beliefs and their behaviors in these lasting ways, like to push them to regularly seek out high quality evidence when they plan and research content, to tackle new subjects, to do more to ensure that their content is accurate. And it also just plugs them into this sort of community of practice that helps them do their work and keeps them in the game, if you will.
Sounds so important. Is there more information about the creator program on your website?
Yep. I
Okay.
can drop the link in the chat.
Terrific.
You'd
Well,
like?
someone just, I'm sorry, was one of our panelists going to say something? No. Okay. Well, someone just posted the exact question I was about to ask Tracey. And Jamie commented that mistrust also comes from healthcare workers and not solely from the communities. Any comment on this phenomenon? Now, we know that there were healthcare workers who were very concerned about vaccination. I'm also interested, Tracey, in how your organization dealt with scientists who were spreading mis and disinformation. That was a problem here. I'm assuming it was a problem in the UK as well. How do we address that?
Well, I think one of the first things is we need to be a bit careful about talking about the process rather than the individual when it comes to science. I mean, we're all big fans of the fact that there are popularizers of science out there. There are great figures, but we do need to be a little bit careful with some of that kind of following of a scientist rather than understanding the questions that they're asking, the processes they're going through. They're designing a fair test. It's the fair test that matters, not the personality that communicates it ultimately. So I think we have to be a little bit careful of the personality cult ourselves, although we can't be robots and just imagine that we publish papers in New England Journal of Medicine and then everyone's going to get it. But I think that's something we just have to tread that line quite carefully and be ready for. The other thing that's quite tricky to explain, but is important, and I found it very important for politicians and for journalists, is when domain knowledge really matters. So being able to comment on a general kind of feature of science is fine, or uncertainty is fine if your subject area is adjacent to the one you're talking about. But when you get down into the discussions about the emergence of a new strain, and whether this had come from being incubated in one person or had been spread, those kinds of things, where you're talking about the genomics or the genetics of population and demographics. I mean, just so much in there that you'd start to get to basically about 7 key experts around the world, one in South Africa, one in California, and that's really the kind of key people. And there is a hierarchy of knowledge, and domain knowledge really does count sometimes. And we did see sometimes people speaking outside of their lane when they really should have been a lot more careful. But I think even just for me, getting journalists and politicians familiar with the idea of domain knowledge and how, rather than this is just a scientist, but do they have the right domain knowledge? How much do you need that for this question? That was a bit of a victory, I think, just getting that concept across.
Jenny, I got to just mention, though, that's such a good point. I unfortunately, in the United States, we have people like the so-called Surgeon General of the state of Florida, who is apparently says he's a physician. But I tell you, here is somebody who has the pulpit for the public, as well as the authority to implement public health measures, who absolutely is outside of his domain and unfortunately is unregulated and unregulatable.
That's true. I mean, scientists and health professionals are people drawn to all sorts of movements too, right? So that is, I'm glad you raised that. Reed, somebody wanted, people are interested in you repeating the website for the Blacks Against COVID
Yeah.
organization.
The Black Coalition Against COVID.org, and just put that in. And the other one, I think I saw someone fly by there and say, asked about the question of on the faith-based initiative. That one is called Choose Healthy Life. So Choose Healthy Life, and that is the faith-based initiative that I think is very praiseworthy.
So we are coming towards the end, and I think we have time for a final question for each of our panelists to respond to. Research America is working with others to create opportunities for early career scientists and really all scientists to learn how to better engage with the public. That includes all STEM professionals. If you were designing a course for this purpose, and Amanda, you at least you have designed a course for this purpose, but what are the top 2 or 3 topics and skills that you think should be part of this training? So Amanda, we'll start with you.
Yeah, so I've not designed not just one, but like a suite of educational opportunities here at Chan to really better equip all the scientists that come through here, whether they're students, faculty, or alumni actually, to communicate about their science in more effective ways. Some of the things that we've begun to teach our students recently since I've been here is how to engage with people about science and health topics with which you might not agree. They're just not skills that we teach budding researchers. They're hard to do, like once you're out in the wild world, and easier to learn in a safe space inside your university. But we live in this increasing polarized world where all these topics have become highly politicized in many cases, and we need to do more there. So that's something we're investing in a lot. We're also training folks how to better tell stories. We know that's what helps make people make sense of the world, and storytelling is what creators and journalists are already doing so well. And so we think, better storytelling not only helps scientists communicate with the public directly, but also to be more effective when they're engaging with these like critical media gatekeepers and be more compelling. And then I just, want to circle back to the thing I mentioned up top. We're really investing more in equipping people to better protect themselves online. Researchers who decide to engage with the public often find themselves not just the object of online hatred, which we touched upon earlier, but sometimes that even bleeds into real life, especially on a number of emerging public health topics that you wouldn't necessarily have guessed might be that way, say 5 years ago. So we are beginning to embed digital safety training in a lot of what we do here at Chan, and have some resources on our website that I can drop in the chat that might be of interest to a lot of other people, along with a newsletter that we run, which is really a place that we're open sourcing some of these ideas you wouldn't have to necessarily be enrolled as a Harvard Chan student to take advantage of.
Oh, thank you. Thanks, Amanda. Let's turn to you, Tracey. What would be 2 or 3 topics that you think should definitely be included in training for scientists to be better at communication?
Well, one of the first things I'd like to do is to put top of that list people's hopes and fears about the society we live in, because I feel that we don't just want a whole bunch of researchers that can do more PR about their latest paper, or get column inches mentioned for their various affiliations. But actually, we want them to take responsibility for the way that we're talking about scientific issues in society. So I think starting always with reminding people that they have hopes and aspirations about the kind of things we've just been talking about here. We've effectively been talking about the kind of world we want to live in. And so they're charting a path on how to get there, and the little bit they might take of that responsibility. So that's my first thing. And the second, I think, is very much the unpacking the whole uncertainty world, and realizing, that it's not as insurmountable as people think. The world is not. Some people have been saying in the chat, the world is binary. It's not binary. We all live our lives in many shades of grey, and with lots and lots of trade-offs that we make. And so I think learning how to plug into the way that we think skeptically in other parts of our lives is really important. I'd just say we actually worked with people who were minded towards conspiracy theories during COVID to create a guide about how to talk to them. We wrote with them a guide about how to talk to them effectively. And it's available on senseaboutscience.org, and but it's really useful to do that, to take the best of what we learn as we try to have respectful conversations and to turn it into resources we can share with others. So I'm actually listening very carefully to everything Amanda's saying and planning to put all of her resources. We're working with Elsevier and with Research America and all the partners that were involved in some confidence in research surveying some years ago, to pull together, you know, the best of what we know as a kind of evidence-based resource for people to use. And I think the more we do that, the better, because there are some, you know, especially post-COVID, there are some hard-won insights that we could really do with sharing, and we don't keep reinventing the same mistakes and learning the most inspired sort of solutions from other people. So I hope that we all do start to share and collaborate around that.
Thank you. Thank you, Tracey. Wise words. Well, we are at our time, but I can't not let Reed have his turn.
Okay.
But just keep it to one or two words, Reed. I know you can be so succinct.
Here it is. What they said.
What they said. All right. I love that. I love that. Well, thank you to this group of visionary leaders and activists really in this space. You've showed us how you are working to break down barriers and build connections. And I'm very optimistic we can get there. This conversation has helped to make me more optimistic. And I want to thank our audience. Wow, lots of comments, good information exchange, really terrific engagement. This is our first day of the National Health Research Forum. We hope you've enjoyed the programming. And thank you as well to our sponsors. We look forward to seeing many of you, those in the Washington area, who can join us for the in-person part of the forum, which will begin at 2 p.m. tomorrow at the George Washington University's Jack Morton Auditorium in Washington, D.C. More information is in the chat. Thank you again for being with us today. I hope you have a great evening.